Greetings to one and all. The topic that we are covering today is disease of child, and I'm Dr. Pavitra Singh, and I'll be taking up this topic. Whenever we are talking about disease of child, we are referring to children with special healthcare needs. And according to American Academy of Pediatric Dentistry, children with special healthcare needs is defined as any physical, developmental, mental, sensory, behavioral, cognitive, or emotional impairment, all limiting conditions that requires medical management, healthcare intervention, and or use of specialized services or programs. These conditions can be congenital, developmental, or acquired through disease, trauma, or environmental causes, and may impose limitations in performing daily self maintenance activities or substantial limitations in a major life activity. So basically, we understand the terminology, but why we need to know this is because we might have to categorize a particular disease, whether it comes under special healthcare disease needs or no. So this is how you can understand that better. Another definition, which was given by McDonald's and Avery, a disabled child is one who has a mental, physical, medical, or social condition that prevents the child from achieving full potential when compared to other children of same age. So now coming to classifications, there are different classifications that have been given. The most like the old one is Frank and Winter, which is given on the left side. The comparatively, the next one that we need to know is the one given by Damle in 2000 that classifies children with special healthcare needs into physically handicapped, mental, sensory, medically compromised, or multi-handicapped. This is for understanding the most useful classification. So, broadly, it is classified into mentally challenged, physically challenged, medically challenged, emotionally challenged, which will learning disabilities, and genetically challenged. So, in mentally challenged, we have mental retardation, cerebral palsy, epilepsy. Then, in physical challenges, we have hearing impairment, visual impairment, or speech impairment. Medically challenged can be your cardiovascular disorders, renal disorders, respiratory, hematological, endocrine, and metabolic disorders, AIDS or liver disorders, and hepatitis. Child abuse and neglect comes under your emotionally challenged criteria. Autism, attention deficit hyperactivity disorder, that is ADHD, dyslexia, these comes under learning disabilities. Then in genetically challenged, you have Down syndrome, Peri-Robin syndrome, ectodermal dysplasia, Treacher-Collin, and Apert syndrome. So out of all these, the most important ones that you need to remember and revise for your NEET exam is your cerebral palsy. A lot of questions have been asked before on that. Autism, Down syndrome. These are the most commonly asked questions, and we'll be covering them in the further slides. Before we go to each one of them specifically, we need to know some specifications of the dental operatory that we need to design for while we are talking about children, treating children with special healthcare needs, which comes under our specialty. So these are some of the differences that will be there from the regular dental setup. That is, the doorways should be at least 4 inches wider, and there should be enough space for a wheelchair to turn around in the space. There are different modifications that can be done to a dental setup, but these are some of the standard criterias or guidelines that you can say that are required to so that we can treat children with special health needs. So these are very well given in your book McDonald's, and you should learn about them from that. Then other part, taking care of children with special healthcare needs. How do we approach them? So there are four main aspects that we have to cater to. First is your home dental care, and it is our duty as a dentist to counsel the parents, because you'll realize in children with special healthcare needs, your this thing, the priorities are not given to your oral health until unless the child is in pain because of very obvious reasons. So whenever we come across a child like that, we must counsel their parents so that they can improve how much ever possible the quality of life of the such children. So the first point is home dental care, then diet and nutrition, preventive restorations, and fluoride exposure. So in home dental care, as we know, we have to first of all, brushing is important. So obviously in special children, the brushing may not be performed by the child themselves. So the parents have to do the brushing. Can be with a normal brush. With, you can see over here, there are different types of grips that are present. So with those kind of brushes, then there are different chair positions that we'll see in the next slide that have to be told to them, in which they can perform brushing for the child, and horizontal scrub method has to be followed. So these are few of the positions in which a special health care need child can be brushing for them can be done. The first one is extremely difficult patient in an isolated or open area and reclined in the brusher's lap. The patient is then immobilized by an extra attendant while the brusher institutes proper oral health care. The standing and resistive child is placed in front of the caregiver so that the adult can wrap his or hand and legs around the child to support and brush the tooth. This is the second way. Then, the sitting, if a child is able to cooperate, depending upon the disability, but if the standing or the sitting child is placed in front of the adult, so that the adult can cradle the child's head with one hand while using the other one to brush. Then the next one is the child reclines on a sofa or a bed with the head angled backward on the parent's lap, and the child head is stabilized with one hand while the other one is used for brushing. So, some standard recommendations. Fluoride should be there in the dentifrice and it should be used daily. Then, chronically poor oral hygiene and high decay rates are a daily regimen of rinsing with 0.05% sodium fluoride solution is recommended. Night application of 0.4% stannous fluoride is recommended, and SDF application should be done in cases of severe caries. Physical restraints of different types can be used for management of these patients. Then coming to the second part, that is the preventive dentistry. So, as we know that children with special health care needs are more prone to oral diseases the because of the they are not able to take care of their own health, and there are different barriers that prevents the parents from taking care of their oral health. So in such cases, preventive treatment is very important for them. So patent fisher sealant applications can be done. Fluoride releasing restorations, fluoride application must be done. Mouth use of mouth guard to prevent them from uh, contracting any kind of trauma. Then oral prophylaxis, anticipatory guidance about trauma must be given to the parents. Diet and nutrition, proper assessment of the diet, dietary modifications are made, proper consultations with patient's primary physician, non-physiogenic diet is emphasized, risk assessment must be done, and early intervention and aggressive preventive care based on the child's risk must be done. Now, coming to the first one, which is your physically challenged. Physically challenged, first we are talking about speech impairment that includes stuttering, cluttering, muteness, voice disorder, anorexia of speech. So there are different classification. Out of these, we need to basically understand about the dental management of such children. So communication can be done through the sign language, specialized skill of obviously knowing the your sign language has to be acquired, or can be done with the help of a speech pathologist. Now coming to hearing impairment, so the severity of hearing impairment is ranked according to the loudness measured in decibels. That can be mild, moderate, or severe. The etiology can be age, long-term exposure to environment, noise, genetics, diseases, medications, exposure to ototoxic chemicals, and physical trauma. So, again, coming to the dental consideration that we have to take care of while dealing with children with hearing impairment, we all know the process of tell, show, do that can be altered into show and do. So, we have to show everything before we perform on them, and that is how we can communicate better using posters and photographs or videos, modeling technique. Clinical history regarding the information of degree of impairment must be taken, and sentences if they are in mild or moderate hearing impairment criteria, the sentences should be short and very specific. Next, coming to visual impairment. So, the most important part for us out of this whole thing is the oral manifestations that can be seen. That is, there is no direct influence in the oral cavity. However, there can be xerostomia, and basically, it affects the way the child who has visual impairment can take care of their basic oral hygiene. Therefore, measures have to be taken in those terms. So, management includes establishing communication, know their preferred way of communication, then instruct them slowly. Braille is used in such cases. Avoid strong lighting and do all the behavior shaping method once the communication is. Now coming to the mentally challenged special children with special health care needs. First, we'll be talking about cerebral palsy. So, according to American Academy of Cerebral Palsy and Development Medicine, it is defined as the group of disorders of the development of movement and posture, causing activity limitations that are attributed to non-progressive disturbances that occurred in developing fetal or in the infant brain. So, the etiology that are in form of four P's. This prenatal, perinatal, postnatal, and prematurity. In classification, it is based on the change in muscle tone, anatomic region of involvement, and severity of problem. It can be hemiplegia, diplegia, quadriplegia, dystonic, and ataxic. Clinical manifestation includes the persistence if persistence of primitive reflexes. They do not suck well, then sleeps poorly, vomits frequently, and has poor eye contact. So, coming to the dental management, which is very important for you, the appointment should be scheduled early. Tell show to positive reinforcement and voice controls have to be used. Uh, Severe visual impairment needs verbal description and modified radiographic techniques. Now, coming to the next one, that is your mental retardation. Uh, American Association of Mental Deficiency, that is AAMD, define it as sub-average intellectual functioning which originates during developmental period and is associated with impairment in adaptive behavior. So there are three levels of impairment. Here, one more thing that you need to learn is the levels of IQ. So, three levels of impairment are seen over here: idiot, umbilical, and moron. And treatment modifications that you need to do for children with for these children include restorative. First thing, glass ionomer restorations appropriate with high incidence of caries. Stainless steel crowns can be used. Then, while doing an endodontic procedure, apex locators can be used more than the using the X-rays. Then, they will sometimes have gingival enlargement, and because of the poor oral health care. And so next is epilepsy. These are not very important from your exam point of view, but you have to basically know what are the oral manifestations that they accompany. So that includes your facial fractures, traumatic injuries, self-inflicted injuries due to seizures. There will be gingival hyperplasia and malodor. Coming to now learning disabilities. First, we'll start with ADHD, that stands for Attention Deficit Hyperactivity Disorder. It refers to a family of related chronic neurobiological disorders that interfere with an individual uh, capa- uh, that basically, sorry, interferes with an individual's capacity to regulate activity level, inhibit behavior, and to attend tasks in developmentally appropriate ways. So, ADHD in children who were exposed to maternal smoke or alcohol during pregnancy, children of parents with ADHD and substance abuse disorder, abnormalities present in frontal lobe and basal ganglion. So, in children, the clinical features that are seen are they have hard time to pay attention, not seem to listen, they talk too much, act and speak without thinking, forget things, and have trouble in taking turns. So, coming to the dental management, these patients again should be scheduled early morning. The appointments need to be short. Then, detailed history should be taken. Next, coming to autism. Autism is a group of neurological disorders that occurs in first 3 years of life. It is a developmental disorder causing disturbance of behavioral development due to multiple reasons and different levels of severity. The autism spectrum disorder includes these different disorders basically. Signs and symptoms that which will help you in recognizing an autistic child would be that in first year of age, there'll be reduced social interaction, there'll be abnormal muscle tone, lack of pointing and orientation. Then they do not participate in group play, they do not recognize other people's feeling, and they're not able to use their body or facial body language or facial expressions. Then in teenagers and young adults, they're not able to see the world from other person's perspective. Then the oral manifestations include they tend to have sweet and sweetened food and tend to pouch inside the mouth, damaging oral habits, bruxism, tongue thrusting, then xerostomia and frequent regurgitation behavior. Dental management includes tell show do technique. It's a must. The while communicating with any child who's autistic, smaller sentences and short words and clear instructions have to be used. Then pharmacological behavior management techniques such as your uh, conscious sedation or general anesthesia might be required. Now, coming to the medically challenged. First is your CVS. In these cases, you have to remember the oral manifestations. That is your delay in tooth eruption, then developmental defects of enamel. They are usually seen, gingival hypertrophy, and geographic tongue. Then dental management includes manual use of manual and power toothbrush, antiseptic periodontal mouth rinses, and 15 ml of Chlorhex can be given to all the patients who are at risk of dental caries. Coming to respiratory disorders, in this, asthma has been asked before, so that you must know, and even cystic fibrosis. Their dental management includes elective dentistry only in patients who are asymptomatic. You have to be aware of the items that can exacerbate asthma and dentifrices, sealants, tooth enamel dust, and 100% oxygen and bronchodilators must be readily available in case of emergency. Now, coming to genetically challenged, it includes Down syndrome, Marfan syndrome, ectodermal dysplasia, pyrobin syndrome, cleidocranial dysplasia, Treacher-Collins syndrome, Clausen, and Klinefelter syndrome. So, coming to Down syndrome, is a chromosomal disorder caused by presence of an extra copy of chromosome 21, that is trisomy of 21. Medical conditions that occur more frequently in infants and children increase mortality rate include cardiac defects, leukemia, and upper respiratory infections. Down syndrome is important again from your exam point of view. Then, in oral manifestations include destructive periodontal diseases, mouth breathing, open bite, macroglossia, fissured lip and tongue, and missing and malformed teeth. Dental management includes systemic factors influencing dental caries, visual and hearing impairment influencing dental care, sleep apnea, intellectual disability influencing the dental care and behavior management, and orofacial features influencing dental caries. These are some of the typical characters. Next, coming to Treacher-Collins syndrome, it is an autosomal dominant craniofacial disorder of first and second pharyngeal arches. Dental findings include impacted supernumerary teeth, hypoplasia, and position alteration of the central incisors. The mouth will be small and high palate. Then, in most of these cases, your airway could be compromised. So, proper referral and evaluation is important. Then ectodermal dysplasia. This is not extremely important from your exam point of view, but you must know what it is. So, and how to identify them. These are the developmental anomalies of ectodermal derivatives. So, whatever is derived from the ectoderm, they will have abnormalities. So, intraoral manifestation includes malformed teeth, gingivitis, early tooth loss of both the dentition, dry and sticky oral mucosa, and partial anodontia. So, according to whatever the manifestations are, the patient will be treated accordingly. Then, coming to emotionally challenged, that includes your child abuse and neglect. It's a total different topic that has to be that will be taken care of separately. This is one of the ways of management of children with special healthcare needs. So, while managing these children, we've discussed about the preventive part, the instructions that we as dentists can give to parents with special healthcare needs. But here we are talking about uh, managing them in our operatory. So, first point that we can take care of is the visual sensation. So it should be according to what the child wants. It can be dimmed, it can be colorful. We have these new robotic projectors that we have. So making the environment dim and more comfortable helps them. Then auditory sensations, light rhythmic music with vibration on the dental chair. Lead apron that can be that can have a hugging effect on the child can be used. These are different ways. This is the room that we're talking about. There are different studies that support that. So, according to these are the recommendations of American Academy of Pediatric Dentistry. The latest revision is of 2021. So, recommendations include first thing is establishing dental home at an early age. Extremely important. We all know what is dental home, so it is important to establish that. Obtaining the medical, dental, and social patient history, creating an environment that is conducive for the child to receive dental care, providing them proper and comprehensive oral health education and anticipatory guidance, providing preventive and therapeutic services, and scheduling their appointment and treatment planning with utmost care. So this is it. These are the references, and this is me. In case you have any doubt, you can always reach out to me. Thank you.